Hi, everyone. My name is Dominica, but I go by Dom. It's a little bit easier to remember. Like Karin said, I'm a transplant life community manager, which has probably been the most exciting thing I've done so far post-transplant. I am also a certified hemodialysis technician. After college, I made the choice to kind of find out what's out there in terms of career-wise, and I ended up working at DaVita. I'm still kind of assessing what's out there for me, but I did that for 2 years. So growing up, I was a pretty healthy kid. You would never think that there's anything wrong with me. I played lots of sports. I ran track. I played soccer. I did my best to avoid doctor visits. Like, if I had a fever, I would try to fake it that I didn't have a fever. I would say I was a little bit too extroverted. So, you would never be able to figure out there could be anything wrong with me, whether I was really not even feeling good in a moment. And as you can see in that bottom picture, I'm also pretty humble. In school, I really loved the sciences. I spent a lot of my extra time in lab. It was a big distraction for me when I first got sick. So before dialysis, I was diagnosed with chronic kidney disease. I have an autoimmune disorder called Wegener's granulomatosis with polyangiitis. It's an autoimmune disease that kind of attacks the vessels of your kidneys, causing failure. When I was first diagnosed, I always thought, like, it can't be me. I don't get sick, right? Even when I was given the diagnosis, I was like, oh, they're gonna give me meds. I'm gonna be fine. People like me don't get sick, right? How can an athlete get sick? But I spent a lot of time in the hospital, and while being in a hospital, I used most of my time studying biology osmosis instead of actually paying attention to what's going on. I was one of those patients that a doctor had to literally pull the information out of me. Unless you asked me a yes or no question, I wouldn't really answer it. And that was the first couple years of my journey. To stop the progression of my disorder, I did chemo treatments, which put me up on the floor with a lot of pediatric cancer patients. And it made me feel like I don't belong in this space, right? I'm not a patient that really should be sharing their story when you have, little babies fighting for their life. So I really just focused on learning as much as I can in school and ignoring anything that was going on with me. When I was first diagnosed, I was at the end of middle school and I was starting high school. And then my kidney began to fail about 4 years into my diagnosis. I was pre-evaluated for transplant and was placed on peritoneal dialysis. And as you can see, the slide has very few pictures because I had a ban from taking pictures from like 2015 to 2017. I really didn't want to share any aspect of my life that had to do with being on dialysis until my very clever doctor asked me to share my story on the news. And I think actually that's a picture of us up there on our local news. And she said, it's interesting that you wouldn't want to share your story to help other patients. And being, kind of young and, impulsive, I was like, I'm going to do it. I'm going to help other people. So that was my first time ever sharing my story. I found at the start of peritoneal dialysis that I absolutely loved the technical aspect of it. I got so excited to learn the machine. I got so excited to be able to do all of that for me, and that excitement faded about 3 weeks in. The lower picture, it's kind of hard to see, but in that picture, there's all the boxes that come with peritoneal dialysis. I would still choose to do peritoneal dialysis more than anything, but that was an entire corner of my room. And every single moment you walk in, you see your dialysis machine, you see all the boxes, and then you just remember that you are a patient, a very sick patient. So I was actually, I really can't complain again because I was on dialysis for about 4 months. My mom was very determined to be my donor. And initially going through the process, she was denied. And I remember coming home, and I had gotten the call shortly after she got the call. And I pulled in, and I knew my mom was going to be devastated. And so I came inside, and she told me how she was denied, but they are asking her to go see a nephrologist, which ended up being very good for her. They found out that she was producing a little bit too much protein and made it look like she might possibly have kidney disease. But what it turned out was that my mom just really likes protein, had a very meat-heavy diet, and they were able to fix that problem. So my mom was approved to be my donor. I was transplanted on February 22nd of 2017. This was my freshman year of college, so I actually started college and I had to withdraw for dialysis. I threw a really big fit in the dean's office when I had to withdraw. But it was the right decision to do it. Any kind of medical issue that you have, whether it's school and work, it's very difficult to balance it. And when it comes to dialysis, when it comes to transplant, the most important thing is taking care of yourself and making sure you have your ducks in a row. And once you're taking care of yourself, then you can really focus on your studies, focus on your work, and focus on the rest of your life. So it's been almost 9 years since I received my transplant. As you could see, up there is a picture of my coworkers at the dialysis clinic. We did a lot to change the atmosphere in the clinic, kind of educate our patients about other options. We were able to pretty quickly start getting patients on other modalities. We got patients who never considered transplant interested in transplant, and we started participating in events, worldwide events. I don't know if any of you guys have heard of World Kidney Day. Sometimes there's different themes, like wearing different socks, so our patients started doing that. Going into dialysis, I really thought my life was over then. I thought I was gonna be attached to a machine, and it wasn't until months after my transplant that I realized that I'm really gonna start living now. I got to watch the surgeon who performed my transplant surgery, perform many different transplant surgeries, and it was a very humbling experience, right? It just made me realize that there is so much out there for all of us. For some of us, it's advocacy. For some of us, it's going into the field and making a difference. And sometimes it's just living your life to the fullest, and whether you decide to share that story or not, that's still great. I spend a lot of time now taking my dogs for a walk. I've participated in Kidney Week, and I decided to get married. So I also became a godmother, which, I'm sure having your own kid is an amazing feeling, but watching your best friend, who was also sick while we were growing up, have a baby is crazy. So I do things that when people look at me, they never think somebody who has been sick could do it. I know how to put a roof on a building. Yeah. I'm the smallest person on a construction site, but I know single membrane roofing. And the biggest thing I've taken away from my transplant is that I'm gonna have ups and downs. I'm gonna be very indecisive about what I wanna do, but I'm gonna figure it out as I go. And if one day I wake up and I decide to do something else, then that's what I'm gonna do. And my mom made sure that I was able to do that. I'm gonna advocate for other patients, and I'm going to meet as many transplant patients as I can and continue sharing their story. And I'm very grateful that Lifeboat gave me the opportunity to be here today and to work with them.
My name's Alex. I'm one of the nurses with Temple that works with the patients post-kidney transplant. I'm going to briefly, if I can get this thing to work, go over what it looks like behind the scenes for myself and my other nurses that I work with, to kind of get patients back to living their life like Dom and Carl and Steve after their transplant. So the transition from inpatient to outpatient, the post-transplant nurses will go see the patient 24 hours after their transplant. I just kind of try to briefly go over what to expect come discharge. Patients are most likely still out of it, not really retaining any information. And I try to stress that to them, like, I don't expect you to remember anything I'm telling you right now, but I want to introduce myself, explain my role, kind of give you an overview of what it's going to look like once you get out of here. We're very active in rounds during the morning after the team sees the patients while they're still inpatient, so we kind of get a good idea of what it's going to look like once they're discharged. If they're having any issues inpatient, how we can get them after the first month. It's kind of the roughest month for our patients post-transplant to adjust to, what we can prepare for in advance for their care once we start seeing them outpatient. And then the discharge education is the day that they finally get to go home. That's when we go over the entire big folder and packet that we give our patients. And the biggest part is the medication teaching. We start that day. It's another thing I tell the patients, I don't expect you to have all of this down by the time you leave today, but just start to get familiar with your meds, start to get familiar with the big pill box that you're gonna have to learn to fill. We do fill the pill box for our patients before they leave the hospital and kind of go through what each med is and what it's used for. And then we ask them to bring it all with them every time we see them in clinic so that we can help them as the visits go on to learn what they're going to be responsible for post-transplant. So once we start seeing patients in the clinic, the first 30 days they see our surgery team. And each visit, as the post-nurse, we go in, see how they're doing, but also continue that medication teaching. We like to have a family member or their support person come with them so that they can also learn all their medications, how to fill the pill box, what to expect going forward. They are seeing us in clinic 2 to 3 times a week, which can be stressful and a lot on the family, but it's very important not only for their health, but to learn how to care for themselves post-transplant, that we see them that often. After a month, they start seeing our nephrology team, and this is kind of where sorry, can you not hear me? This is where appointments start to space out a little bit. We start seeing them weekly as long as their health, lab work, how they feel, everything looks okay. And then medication management, it starts to get a little bit easier. There's not as many changes. Sometimes there's a little bit less meds once we get to nephrology, but you'll hear from Kevin, our transplant pharmacist, next. We work very closely we have them in clinic with us for any questions, medication changes. It's a very collaborative effort to make sure that the patient is getting the right immunosuppression, staying on track, and we keep them healthy and not rejecting their kidney. Just to talk about some barriers that we face, that our patients face, transportation is a big thing that sometimes we know before they're discharged that it's going to be a problem. Other times it's once they start coming to clinic so often, and sometimes family and friend support kind of waxes and then wanes, and they have trouble getting to appointments, or they live far away and we kind of have to plan before they're discharged how they're going to get to see us so often. We do work with social work closely before and after discharge, depending on when these issues arise. We can get insurance coverage to hopefully help pay for rides to get them to and from clinic to see us, as well as the Gift of Life House for patients that are far away. They can plan to stay there for the first couple weeks, month post-transplant, so they can get to our clinic and get the care that they need. I kind of already touched on the support. Sometimes things happen once you're transplanted, and even for the patient, they don't realize that it's still a lot, it's still daunting, there's still a lot that goes into it, especially the first month. So people that they thought would be there for them sometimes aren't able to be as much of a support as they hoped they could be for that patient post-transplant. And they lean a lot on the nurses, the social workers, outpatient, when we run into a lack of support. Insurance coverage for the immunosuppression is a big barrier, and this is another time when we work with social work to get them into patient assistance programs. Our pharmacy at Temple, we can get one of their immunosuppressions like free for the first month, and that gives us a little bit more time to figure out what kind of program we can get them into. And then our financial coordinators help us with what specialty pharmacy they need to be filled at. If they can't get their meds at Temple or just like the local pharmacy around the corner. And then I think the stress of the major life adjustment that comes with being transplanted, like you don't just get your kidney and then like everything's back to normal. And I think that sets patients back in their own minds that like, wow, this is still a lot to deal with. it's still going to be a while before I can get back to doing the things that I hoped I could do. But sometimes as the post nurse, you just need to be like a sounding board for your patient and just listen. And they're not always looking for a solution, but just like validating that, yeah, this is still really hard. And yeah, it's going to take some time, but I know I have people to support me to get me through to that end point where I can get back to doing the things that I used to be able to before I got sick, and that I'm hoping to do with my friends, family, myself. Being a nurse, I feel like, isn't always the medical part. It's really the social support and just validating that your patient is going through a lot and is going to continue to go through a lot, but like we're here to help you through the whole journey. Even once you get to the point where you don't have to see us for 6 months to a year at a time, you can still call us, and even if you just want to chat, like I have patients some weeks, I can tell just want to talk, and sometimes that's what they need, and there's nothing medical I can do for them, but I can be there for them in whatever way that they need me to post-transplant. I think that's it. I think that's my last slide. Oh, there's Dr. Shaven.
I wanted to just follow up on that continuing support that is both mental, psychological, and medical, of course, to both of you. If we start here from the clinic perspective, I mean, you have a focus in the first year, I would assume, but you continue to support the patients over time. You know, do you have coordination with other specialists directly from Temple when it comes to perhaps side effects, complications, comorbidities?
So in clinic, when we see the patient, usually in like the first 30 days, even sometimes after, but we'll need to refer them to endocrine if they had diabetes beforehand and it's still not well controlled, or if suddenly they have blood sugar issues post-transplant, or like we'll make the referrals. Our support coordinators are fantastic, and we'll message them and be like, hey, this patient needs to see endocrine, hematology, nutrition, psych, and they'll set the appointments up with date, time, call the patient, so all they have to do is get there. Like we take care of all of that, and then we do, when we see them, make sure that, hey, when's the last time you saw endocrine? Like we kind of keep them on, we try to keep them on task as much, because it's so much for one patient to remember, but we are very active, and like our infectious disease doctors, we talk with weekly, just on the side, like not necessarily always formal, like, hey, they need an appointment, but hey, this patient had this problem, like, how's it going? Like, we're very interconnected with the specialists for our transplant patients.
That's wonderful to hear. You're functioning almost like the coordinator for their entire care.
Yeah.
Dom, in your case, who's managing you, and what have you seen as the biggest hurdles post-transplant when it comes to medical care?
Yeah, sure. So I started my transplant with the pediatric team, and I believe it was about 5 years that I had them. I didn't want to leave. I loved them so much that I left and then I came back. But they were a very organized team. I mean, there was a social worker, a dietitian, the nurses, like 3 nurses, and they all knew each patient very well. And there was a big push on the patients speaking up for themselves and sharing with every team member what's going on. And so there was a lot of follow-up, and that's kind of how I became, I suppose, a good patient, where I knew what questions to ask, I knew when to push, and be able to kind of look ahead as to what might be a problem and what not. I think now, moving out into adult transplant and kind of have been to 2 different transplant centers. I'm no longer followed by a transplant team. I see a regular community nephrologist, which comes with its own hurdles. I have, she's a phenomenal physician, and I have great and productive appointments, but it's hard when you're no longer seeing a whole transplant team and you no longer have access to the dietitians and all the other people. And I think, you could always request that, but it's not as easy as when you go to a transplant center and they're right there.
I think that's a really important point. Thank you. Thank you for sharing that. We can open up for questions if we have, otherwise I can continue. But if anyone has questions for Dom here, or Alex, Please raise your voice. Yes? Carrie?
Microphone. Yes. Question for Alex. So with transportation to those, you said monthly clinic visits right after the first month post-transplant. So if transportation is the barrier, is there any reason that they couldn't be virtual visits? Like if the patient went to a local lab, had their blood drawn, and then had a virtual visit?
So I know before I started with Temple, they did do virtual visits with COVID. We don't do like telehealth visits per se, but if our patients are doing well enough and they can't get to a visit, we'll say, hey, just at least go get these labs. I'll look out for the results. I'll go over them with the team, and then I'm gonna call you if we need to change any of your medications. So while we don't offer telehealth visits, we will work with the patients as long as they're a month. Like, it's hard in the first 30 days to be like, yeah, you can skip your clinic visit, but a month or so out, we'll definitely work with the patients, and at least as long as they can get labs and we can review them and we can change their medication, that's the most important aspect of it.
Anyone else? Yes.
Does Temple have a digital app to monitor their patients?
They do. They have, well, so like for the patients or like for the patients to use,
Yeah.
we have like My Temple Health where you can log in, you can see all your appointments, you can see your lab results, you can request your med refills. So there is an app that Temple offers to kind of make things a little easier as well for the patients.
We have an app as well. We have a great app. Am I allowed to say that? Cool. We have an app. I would never tell patients, whatever your hospital uses, that's phenomenal, right? If you know how to work my chart and all that kind of stuff, that's great. But we have an app for transplant, and it's built by transplant patients. It allows you to keep track of all your medications if that's what you need in the beginning is reminders. I started using my app a few months ago. I had a routine and everything, and I still have days where I forget things. Sometimes I have to run out of a house, and I just forget it, and I get a reminder, and at least then I know I know pretty early on rather than remembering it when I'm 2 hours, driving to work. There's other functions on there. There's functions like keeping track of water, which is really important for us, right? We talked about that earlier in the day about how hard it is to go from having a fluid restriction to then having to drink a lot of water, right? It has a big impact on us. There's a symptom tracking function, and I'm blanking because I'm nervous, but there's a lot of stuff on there. It's great. And the best part about it is when you're ready to go to your appointment, all you have to do is create a report, and all of that will be right there for you. And you could print it, or you could just keep it on your phone, and then that way you could have productive discussions with your physicians.
And if you want to learn more, you have some information in front of you, a QR code, I
do
believe.
want to go off of the symptom tracker that you mentioned because we do have nurses on call and physicians 24/7 for our team. So even after hours, there's a nurse on call. You can call the same phone number that, is it not working? Is it not close enough? We have a nurse on call 24/7. So if you're using that app and you track some symptoms that you're worried about, you can call us. We'll either send you to the ER, we'll tell you to come into clinic the next day. But it's very helpful to have that resource available, and especially if you're using in collaboration with something like that.
It's good to ask questions, right? Like,
Yeah.
Even if something doesn't seem that important, just ask about it because you just never know. And if something feels off, as a patient, if something feels off, just ask. That's what my team always did. And when I was younger, I didn't really follow up on it. Sometimes it would be too late. I would end up in a hospital. But it is a big, important part. And at least then, it gives you a little peace of mind because if it's eating away at you and you're not sure,
Yeah.
it's not making your day any more productive.
I tell all my patients that I'd rather you call and I tell you, like, you're okay, you can wait till your next visit, than not call and something be seriously wrong, and then we miss it.
That's so reassuring to hear. Thank you. Leslie?
A question from online. Does Temple follow kidney recipients for life?
We do. If you choose to keep seeing us for life, you can. A lot of patients sometimes, once they hit so many years out, they kind of transition to seeing like their local nephrologist, and then us, like every 6 months they go back and forth. But we have patients that are 20 years out that still come to clinic, and we see them So we're here for you if you want to keep following with us for life.
That's great.
One more question that's being talked about in the chat is mental health resources for post-transplant patients.
So we have our transplant psychologist and team that they work with before transplant, like when they're being eval'd. So we're always able to refer back to Dr. Coombs is our physician that we work with if they're having any kind of issues post-transplant that they'd like addressed. We always have that option to refer back to him, and they can make an appointment to see him.
Thank you. Question for both of you in the capacity of provider and patient. You've talked a lot about the different specialties, Alex, how you can refer, and you do refer, even in the beginning of the journey. Is there a person who makes sure that the patient also does maybe not just when something goes wrong, but more the screening, the vaccines, and keeping track of that? And then Dom, for you, do you do that yourself, or is someone telling you to do that and keeps a record for you?
So in our clinic visits, either the nurse practitioner or the nephrologist that sees them, that's part of their note that they keep in the patient's chart of what vaccines they've gotten, when they're okay to get them post-transplant, because you don't want to be getting vaccines in the first 30 days because it's not really going to do anything for you with your immune system. And then a lot of times the patients that are getting them will send us the records like, hey, I got my flu shot, or hey, is it okay if I get the flu shot? Can I get the COVID vaccine? So the nurses, the pharmacists, the doctors, and the nurse practitioner, that's built into our visit that they come see us in clinic that we discuss.
Great. Yeah, like I said earlier, when I had a pediatric transplant team, it was just pretty much everything that was outstanding was discussed with me at every visit, and I kind of carried that into, my own personal care now. I use I use the app. I have things that I have to get done in the future. They're not things that have to be done right away. They don't have to be scheduled right away. But I know I'm going to forget about them. So I have vaccines that I also have to get done. And because I don't have insurance, I'm going to be very selective as to where I go get them done. And some of them might be at a CVS clinic. Some of them might be somewhere else. And I mean, I'm knock on wood, and very lucky to not have to follow a whole lot of other doctors anymore. But that used to be my thing, is I used to put it in a schedule to, this is something that you have to follow up on. I don't have a thyroid, so I have to get thyroid labs done every once in a while, every 6 months, every year. And, keeping kind of a schedule for yourself, because doctors also forget too, right? It's, I think you guys seem very unique. You guys seem very unique into how you follow your patients. But there's this sort of you have to own it. You have to own whatever is going on with you, and you have to stay on top of it. I think a lot of other places, it's not in a way their responsibility. It's nice to have a clinic like that, right, where they kind of work with you as a team and remind you. But you have to kind of keep track of what's going on with you. My big problem is unless I'm dying and I can't move, I don't really want to talk about it or bring it up to anyone, but it's something that I continuously work towards, is to just stay on top of things, right? The worst thing to do is to ignore it and then end up in a hospital and make things way worse.
Absolutely, thank you. No, it does seem to be Leslie from the platform.
On Zoom, as a patient with many specialists, in addition to a transplant team and PCP, is there any advice on how to navigate healthcare and treatments when there can be contradicting recommendations?
So we get this. I do get this a lot with our patients. I'll say transplant patients are very good at coming to us and being like, hey, my primary care said I should take this or decrease this or stop. They'll come to us first and be like, I just want to make sure that it's okay with nephrology and transplant before I change anything. So it is a lot of competing recommendations and ideas, but our group of patients, I will say, is very good with coming to us first and be like, I don't want anything to happen to my kidney. you guys tell me what I should do. And sometimes it's just us having to call the other provider and be like, can you just explain a little bit more of like what's actually going on? But always reach out to as many of your specialists as you need and take control of your own life and your health. Because even if you feel like, oh, I don't want to bother these people, that's what we're here for. We want to make sure everything is okay and that you're doing exactly what you need to for any of your providers to keep yourself healthy and keep your transplant healthy.
And I think in our work with so many patients, we have really seen that transplant patients are incredibly loyal to their transplant center and trust their transplant provider, the surgeon, the nephrologist, the nurse, the coordinator, the dietitian, everyone on the team. I think that the big dilemma is if something happens acutely or if the patient just is not there, mentally, then they're suddenly in a situation where they can't maybe reach out. So then there must be something on them that kind of describes, or that the family knows about their medication, right? Because the medication per se can pose problems for other medications if they're being treated in an acute situation. So, I mean, that's a very special case, but I can see that being an issue. Okay, anything more? Yes.
You speak a lot about how the app is a great resource for you to manage medications and track your health metrics. Could you let us know where you could find the app and what's the name of the app?
I would love to. So the app is available on Google Play and on the app in the App Store for Apple, right? If you look at a lot of our brochures, whether you scan it from here or you grab a brochure out there, you could scan it right from the QR code. You could go to transplantlife.com. We have all of our information out there. And you could also, if all you remember from today is @LifeBulb, that's great, because if you go on our social media, you'll see the app and all the resources over there. Sorry. Transplant Life 365.
Thank you. Anyone else? Okay. Well, thank you so much. Thank you for sharing and thank you for educating.